Get started. So this is Pat Bebo from Ohio State. I want to welcome everybody to the call. It's kind of exciting to be able to present this to everyone in our region. I'll just give a little historical background, and that is, and then I'm going to turn it over to Anna for a second. So 3 years ago, I think now, when SNAP-Ed guidance became more focused or was shifting us a little bit more to PSEs, Darcy and Friedman and I from Case Western Reserve University and I had a meeting. She came to meet me to see what we were all about, and she was at the time it still is part of the Case Prevention Research Center, and we had this discussion, and I said, we're moving into this PSE realm, and what I noticed as part of my experience in working with PSEs prior to coming to Ohio was that oftentimes there were people good, well-intentioned people sitting around a table thinking about how they can make their communities healthier, coming up with ideas, do something, and then not knowing if they had the capacity or if they had the right partners at the table to effectively implement a PSE, mostly an environment change. And my go-to explanation or example was everybody sitting around the table and saying they wanted a farmer's market. And everybody getting all excited, all the community members getting all excited and going to decide where the farmer's market would be, and finding out that A, they didn't have a farmer, and B, they needed water, they needed electricity, all these barriers to this environment change happening that they didn't think about. People getting dejected and then walking away from it. And we didn't want to see that happen. So Darcy took that idea and with her team created a methodology that turned into our PSE READI, and we partnered in this with creating healthy communities through our Ohio Department of Health. Created this project called Building Capacity for Obesity Prevention, and PSE READI was born. So I'll turn it over to Anna, who will tell you about our presenters for today.
Okay, well, thank you, Pat. Good afternoon, everyone, and welcome. Like Pat said, we're really excited to start letting everyone know outside Ohio about this really good tool that this group has created. And again, I'm Ana Claudia Subieta. I'm the Ohio SNAP-Ed Director. And it is my pleasure to introduce to you the speakers for today's presentation on how to use the PSE READI tool for our communities. So the first speaker, Dr. Darcy Friedman, is the Mary Ann Swetland Professor excuse me, of Environmental Health Sciences and the Director of the Swetland Center for Environmental Health at Case Western Reserve University School of Medicine. Her research focuses on developing, testing, and disseminating policy and systems level interventions to promote health equity by addressing the complex interplay between public health and the environment. She's nationally recognized for her scientific contributions to community nutrition. Her technology, FM Tracks, is now the gold standard method nationally to evaluate healthy food incentive programming. She regularly advises and testifies to inform federal, state, and local nutrition policy. Dr. Freeman was awarded the Sarah Samuels Memorial Award for outstanding contributions to advocacy, policy, and evaluation for public health nutrition by the American Public Health Association. And she currently serves as co-chair of the Cleveland-Cuyahoga County Food Policy Coalition. Our second speaker, Dr. Jennifer King, is a research associate for Building Capacity for Obesity Prevention project at the Mary Ann Swetland Center for Environmental Health. In her position, Jennifer supports the dissemination of the PSE READI instrument. Before joining the Swetland Center, she aided in the launch of the Kent State University Institution Y Health Initiative while serving as a graduate student there. She has also progressively developed her skills to build and maintain relationships, to encouraging community engagement and connectivity while studying the determinants of health in Cleveland's largest neighborhoods. With these experiences and her current work, Dr. King is continuously strengthening her skills by working on collaborative and multidisciplinary teams, large-scale projects coordination, and evaluation management. So it is, again, my pleasure to introduce them, and without any further ado, I let them present to us right now.
Okay, thank you, Ana Claudia. Before we get ourselves started, I just wanted to go over some housekeeping guidelines for you all. So during the webinar, your speakers will be muted, so of course we will not be able to hear you. But as we begin to ask you all questions throughout the webinar, you are encouraged to unmute yourselves, or if you are unable to unmute yourself, I will go ahead and unmute you on my end. You can also use the chat feature to communicate with us, and you can do so by clicking on the chat icon that's located on the Zoom navigation bar, and a window will open on the right side of your screen, and one of our staff will respond to you and help you troubleshoot any issues. The webinar is being recorded and will be available to view again soon and share with your colleagues, and it will be posted on psereadi.org. If you're having any type of connectivity issues, please use the Zoom information that was posted in the chat box for your reference. You can also email us at bcop@case.edu, and we will help you with any connectivity issues that you might be experiencing. So Darcy will now get us started with the review of the BCOP project.
Great, thank you, Jennifer, and thank you, Ana Claudia and Pat and Eric, for inviting us to be on the call today. Just to get us started, we will be using some acronyms, and we thought we would review them from the beginning. We'll explain them throughout as well. You've already heard about the BCOP, or Building Capacity for Obesity Prevention Project, which is the umbrella project for our collaboration with Ohio SNAP-Ed. Of course, you're very familiar with SNAP-Ed. CHC is the Creating Healthy Communities program run through the Ohio Department of Health here in the state of Ohio. PSE, Policy, System, and Environmental Interventions or Strategies. And in our project, we look at 4 specific PSEs related to farmers market, healthy eating and childcare, farm to school, and healthy food retail. And then lastly, the PSE READI, which stands for the PSE Readiness Assessment and Decision Instrument. And you'll be hearing a lot about how that tool was developed and now being disseminated in Ohio and hopefully beyond. So in terms of our presentation today, we're going to start off with some rationale for establishing the BCOP project and the research approach we used to develop the PSE READI tool. We'll then go into more detail of the process for developing the PSE READI website and tool, and then provide more information about the features on the website and methods we've been taking over the past year to disseminate the tool within the state of Ohio. We'll have finally a bit of time about our next steps and then open it up for Q&A. Like Jennifer said, we do have a couple of questions built in. We welcome comments via chat. And you know, if you have a question as we're presenting, we'd be happy to take that. So at certain points, we'll stop and check to make sure there's nothing to answer. So in terms of the rationale for the study, I always think this chart is worthwhile to come back to every now and again. And all of us know obesity has been on the rise in the United States, but I think, you know, I recently was looking at this slide and just reminded of that shocking increase in 1976 to 1980 up to the the late 80s, early 90s. I mean, that slope is so high. And there's a lot of questions about why did we have such a high rate of obesity? From the period of 50 years, obesity rates among women more than doubled from about 15% to 40%, and rates more than tripled for men during the same time frame from about 11% to 35%. And of course, most of us are very familiar with the fact that in the United States, obesity does not affect everybody in the same way. Among non-Hispanic white adults, more than 3 out of 10 were considered to have obesity, and this is based on 2013-14 NHANES data. During that same period of time, among non-Hispanic Black adults, almost 5 out of 10 were considered to have obesity, and among Hispanic adults, about 4 out of 10 were considered to have obesity. And so from a public health perspective, we care about obesity because it is associated with increased risk for chronic diseases like diabetes, arthritis, heart disease, as well as cancer. So given the racialized nature of obesity trends in the United States, there is growing attention to an equity-oriented framework for obesity prevention. And here's an example of a framework that came through the National Academy of Medicine in 2017. And in this framework, you can see there's 4 different areas of focus. And within the BCOP project, we're targeting that focus on increasing healthy options. And in particular, at this stage over the past 4 years of our partnership, we've been looking at food retail and provision, healthy food options in schools in particular, and changes to the built environment as a strategy for addressing food access. And that framework has been translated into a number of recommended nutrition-related interventions. So here you can see various examples from the CDC and the IOM. So for example, or the Institute of Medicine, the very first one, there are recommendations from both the CDC and the Institute of Medicine to address obesity by encouraging small store owners to offer fresh produce and healthier foods through financial or other incentives. And if you come down to the very bottom one, another example, establishing strong nutrition standards and healthy food policies for food served at public facilities and government buildings. So the point in this slide is, and really the rationale behind our project, there's this growing attention that environmental policy system level interventions are important for obesity prevention, and they're coming out in various kinds of recommendations and intervention packages. And in our project, if you want to go to the next slide, Jennifer, we came together and formed the Building Capacity for Obesity Prevention project in 2014 to basically say, how do we move, and one more slide, just to here's our team. We are a team at Case Western here with our Jennifer and I and Karen Valeris, David Nindahimana, and Elizabeth Benninger. We have colleagues at Ohio State University and then at Ohio Department of Health. But my point, kind of building up to this, why did we form BCOP, is this gap between these recommendations for creating community level changes and actual real world implementation. And that meeting that Pat was alluding to earlier, this black box between what we know we should be doing and what policy is even requiring us to do and what we're able to do in the real world. And in reality, as all of us know, no two communities are the same. And so there isn't a one size fits all approach to community level nutrition implementation. And so our overarching goal in BCOP is to optimize implementation of community nutrition interventions within diverse local environments, and with the broader goal to promote healthy eating and prevent or reduce obesity trends. And this is a figure that kind of helps you think through the rationale of our specific focus right now within the BCOP project around developing our PSE READI tool. And so in this image, you can see, and I kind of think of this as like going to IKEA. If you go into IKEA and you don't really know what you want to buy or what's even available in there and what all these different rows offer, it feels like a big maze and it's very confusing and you can get lost quite easily during that process. And so we think about, you know, for community members and SNAP-Ed practitioners in counties, you know, when you're navigating the system of evidence-based PSE strategies, it can feel like the image at the top without a PSE ready. You're not really sure where to go, what's right for your community, what's right based on your current level of capacity. And what we're seeking to do in the PSE Ready project is to try and streamline that process, knowing that the path that you're going to take if you're coming from Cuyahoga County, which is the county where we're located here in Cleveland, might be different than the path that you're going to take from Ashtabula County, which is one of our counties on the border of Pennsylvania and also defined as an Appalachian county in our state. And so the point in our process in developing this tool is to try and help an end user, a SNAP-Ed practitioner, a community member better identify what's the right step for our community given our reality now. And that our goal is to increase implementation of these PSE strategies, but we take into account that how you plug into the pathway is going to be very different based on your local readiness and your local capacity. And so, you know, at the high level, our projects takes into account this idea that, I mean, we all kind of get at in concept, is that one size won't fit all. And implementing, as Pat said, farmers markets in a community that doesn't even have one farmer is a very different process of implementation than a community that has 10 active farmers markets. They all currently accept SNAP and they all have an incentive program. And now you're really looking at, like our colleagues now in SNAP-Ed working in the Toledo area, how do we do more community engagement through peer-to-peer outreach models to promote use of those amazing community resources in the area. And so, you know, that kind of gives you some framework for the background of our project. In terms of, and maybe just to stop right there about the rationale for the BCOP project, are there any questions from the group or any points of clarification? Okay. So moving on to our process. So before we get started with our process, we wanted to get a sense, it looks like we've got about 13 different attendees on the call representing a number of different states. Would you be willing to share, and you can either type it in or you could unmute and share out, what types of PSE strategies are relevant to your region? And again, if you're muted, you're going to need to unmute to share. So I see farmers markets from Yolanda. And Yolanda, where are you at? Okay, so in Wisconsin, farmers markets. Any others? Becky or Dawn or Jessica? School or community early childhood pantries, farmers markets from Becky. We see from Dawn, schools, childcare, low-income work sites, faith-based organizations, food pantries in Michigan. Wisconsin, they're also working in food pantries and meal sites. And then Lila has shop, learn, and play settings are the most common. And we're going to end our presentation today talking a little bit about, future opportunities for the PSE Ready tool. But I think what you're sharing here are a lot of the existing focus areas within the BCOP project and kind of ideas we've been hearing for the future, and hearing a lot around the food pantries. Okay, so for us, the first step of our process was to identify what PSE topic area should be the focus for our project. And we knew that we couldn't tackle all of the opportunities. And so some of the steps that we took were, we looked at SNAP-Ed Toolkit, what was being recommended. We looked at, like I mentioned earlier, CDC, IOM, and other kinds of recommendations for PSE implementation. We talked with Ana Claudia and Pat to hear what were some of the areas of interest within the state of Ohio. And ultimately, we decided in the first round of the PSE Ready, we would focus on 4 topic areas, and you can see them on the slide. So our tool is currently focused on farmers markets, healthy eating and childcare, healthy food retail, and farm to school. And then within there, we look at policy, system, and environmental change. And so, for example, under policy, one of the things that the PSE Ready tool could be used is in a community that may be looking to limit sweetened beverages and or fried foods, for example, in a childcare setting. In terms of systems level change, related to it could be within the farm to school space, somebody that's working in collaboration with a number of partners to increase locally grown foods purchase for the school cafeteria. And then under environmental change, an example in the healthy food retail space would be promoting a healthy checkout aisle. And once we identified our topic areas, we went through this multi-phase consensus approach to build the PSE Ready tool. So the very first phase was a qualitative research phase. And during this process, we went to 9 counties throughout the state of Ohio. We focused on 5 urban and 4 rural counties. And we picked them because they represented diversity around the state. So we really wanted a kind of a representative perspective. And during that process, we met with 194 SNAP-Ed or CHC practitioners and community residents. And that was through 18 in-person interviews and 23 focus groups. Our focus groups were conducted with SNAP and SNAP-eligible participants, as well as in each of these counties, there was a community coalition organized by the Creating Healthy Communities, or the CHC program. So we went around the state, we collected a lot of qualitative data. We then began the process of analyzing the data to develop indicators and themes. And the idea was we wanted to organize, themes of what did people say was important in terms of readiness and capacity to implement those 4 interventions in the community. And then within each theme, what were the indicators that could be used and mapped onto that, back up to the theme. That was an iterative process. We got a lot of feedback from our team members. And then we went in for each of the 4 topic areas, we held an expert panel meeting. And during the expert panel meeting, people received packets of materials of themes, and they also received indicators, and we went through a process of voting and ranking on which themes were the most important, and then within the themes, which indicators were most important. And during that process, we learned that some indicators could be combined into one, some things could be, we could get rid of altogether. And ultimately, we went through and refined that down into a final set of indicators and themes. And we did a pilot study where we practiced the tool with a number of practitioners in the state of Ohio to get, make sure, does this make sense? Is the wording appropriate? We actually made a little bit of additional refinement before we transition into movement onto the website. So ultimately, through that process, from developing in phase 1 all the way out to phase 5 of pilot testing, it took about 2 years. And during the past year, we've been using the time to do a lot of refinement of our website and training and getting people to kind of take up and use the website. And if you want to go to the next slide, I reviewed a lot of detail about process and methodology that has been published now in a number of publications. So here are 3 examples. The first one in Translational Behavioral Medicine reviews our process and gives you more information about the development of the farmers market assessment tool. The second paper in the Journal of School Health is more focused about the farm to school assessment tools. And then the last paper in Journal of Nutrition, Education, and Behavior is focused on healthy eating in childcare settings. We're currently working on the final paper that's for healthy food retail. And if you're interested in any of those papers, if you email bcop@case.edu, we'd be happy to send you those. So ultimately, during this process of qualitative data and expert panel and refinement and pilot testing, we ended up with 4 different tools, again, that we call the PSE READI. There's a farmer's market, healthy eating and childcare, healthy food retail, and farm to school. And each of those, you can see, have a range of themes. So those are the broader concepts, and in a minute I'll review what those themes are. And then they range, each assessment has between 17 and 30 total indicators. So for somebody to take a PSE READI during our online platform that Jennifer is going to review in a minute, it is not going to take you very long, because I mean at most you're answering 30 questions. This slide reviews the themes across the different PSE topic areas. And in the check, you can see whether that theme, which goes on the left side there, is related to the different topic areas. So for example, the first 2 themes, organizational and practitioner capacity and networks and relationships, these were found to be relevant for all 4 of our PSE topic areas. And then community resources and motivations and logistical factors were found to be in 2 of the 4, and then all the remaining are really more specific to that PSE topic area. In the next slide, I've just highlighted the top rated indicators per PSE READI topic area. And as I mentioned in our expert panel meeting, we went through a process of ranking. So every indicator has a weight or a, sort of a ranking. And within each of the topic areas, you can see, for example, in farmers market and healthy eating and childcare, those indicators are very much tied to organizational budget to support implementation of the PSE. So basically, if you're in a community and there are no funds, that may be a real roadblock to moving things forward. And then you're going to be doing a lot of work around, how do we get some resources to move this work forward. If you look into healthy food retail, the number 1 indicator, or the top rated indicator, is related to corner store buy-in, essentially. Do corner stores, convenience stores, and gas stations in your service area have positive perceptions about increasing healthy food options for sale in their store? So if you are in a community and you haven't even begun conversations to learn if this is of interest to local corner stores, then that's an important first action step. And then lastly, in farm to school, again, here a big factor that's going to influence implementation are food service guidelines. Are there guidelines in place that would allow you to do more farm to school efforts? And so before I move on again to the next part of translating all of this into the website psereadi.org, I just wanted to see if anybody had any questions.
And please remember, so that we can unmute you all, to use the raise hand feature and we'll be able to see who has raised their hand, and then we'll be able to unmute you manually.
Okay. So without any questions, I'm going to kick us off, and then Jennifer is going to take us on through the website. And if you're on your computer, you're certainly welcome to go on and log into psereadi.org. So while, you know, all of this information I've been sharing with you so far is really important and really interesting and key that we were able to disseminate out through the academic journals and through other kinds of presentations, ultimately we knew for this to make a difference in the community, it had to become a tool that was accessible in a useful platform that could be incorporated into the practice of a SNAP-Ed practitioner. And so we created PSEReadi.org to support community nutrition practitioners to assess their community's readiness and capacity to implement community nutrition PSEs, to use that assessment to then plan next steps and guide community nutrition PSE implementation, and then lastly, to actually move from the planning stage into the acting stage in your community, taking advantage of over 1,000 PSE resources, as well as a tailored implementation plan to, you know, sort of take one baby step, if that's all it is, around PSE implementation in the local context.
Thank you, Darcy. So now we're going to kind of go over the key features of the PSEReadi.org website. And we're going to start off with our PSEs in action, followed by what are the resources that are available to practitioners, whether it be yourself or your staff or your colleagues, in helping you kind of get through that process of planning, assessing, and acting. Then we're going to actually walk through a PSE Ready assessment, and then follow up with how do we use that report that's immediately generated after an assessment is completed. So I'm going to transfer ourselves over to the website. All right. So here is the homepage of the BCOP, our PSEReadi.org website. As we've already learned about some of the various strategies that are relevant to your work in your region, we can find that sometimes practitioners still feel as though they may be the only one kind of struggling through implementing a PSE program, or aren't really sure if they're making a big enough difference or change in their communities. So what we've done is created the PSEs in Action video series to help inspire and encourage practitioners doing their PSE work. So before we go over to the PSEs in Action, you can just take a look at our homepage, and it really reiterates what Darcy said about assessing, planning, and then acting out on the recommendations that you will receive once an assessment is completed, using resources that are tied to those assessments. So as the page loads, we can see that each PSE topic area has kind of a case studies or playlist of different videos that feature real stories of successes and challenges with assessing, planning, and acting on how to implement PSE programs. After today's training, we certainly encourage you to take a look at all of the videos. They are about 2 minutes in length, but they're covering from our farmers market, barriers to farmers, healthy eating in childcare, advice and challenges, healthy food retail, partnerships and collaboration, and farm to school, getting through, again, those partnerships that are so essential to being able to actually and effectively implement PSEs. Now, as we think about how we want to use our videos, let's try to keep something in mind. And let's say if a video really caught your attention and that you'd like to learn more about a particular topic. So as Pat has talked about farmers markets and what are the challenges that people have faced with either getting a farmers market established or being able to promote a farmers market. And many of you shared that, that is a focus of your own within your region. Let's take a look at new ways to actually be able to work within our farmers markets, and doing so, access our resource library by clicking on PSE resources at the top of this page. Okay, so as Darcy has mentioned, the PSE Resource Library is a large collection of web-based tools, websites, guides, and toolkits. We've gathered them into one kind of central location to help those who are working in community nutrition environments easily find resources that may be useful in their PSE work. So from our PSE resource main page, you can see several features. So first, within our navigation panel are the 4 topics that you have to choose from within our focus of PSE areas. By default, it will always select farmers market, but you can see that you can select the other PSE areas from the drop-down menu. I'm going to leave it as selected for farmers market just for the sake of our example today. You can also sift through additional resources or kind of create more of a focal area for yourself by looking at the various categories that we have available that fall under the farmers market PSE area. So for today, again, we're going to stay within farmers market, but we're going to actually use our search resources option, where we can type in a word that might be of interest, and it can actually kind of whittle down our results even more for really tailoring in onto the resources that you want to find. So for today, we're going to think about a farmers market vendor who wants to educate community members about the produce that he sells at his stand. A great way, as we all know, to educate shoppers is to involve them in the process of being able to actually learn about the produce with a food demo. So let's say if we selected our search resources box and typed in cookbook, we can see that resources that are tied to the theme of cookbook or have cookbook in its title will pop up for us. So we're actually going to click on Farmers Market Cookbook. And you should see at the top of the page an additional window open, so you won't lose your place on the website, but you're able to access resources like this, something that is very vibrant and inviting to the eye of the user to want to be able to help our farmers or help our vendors think about ideas of preparing interesting recipes to stand out and to allow shoppers to taste the produce that that he or she is selling. So we're gonna go back and talk about a number of different features that you can actually use with the resource that you found. So let's say that the vendor, he or she, likes the resource that they found. With an account, and it's very easy to set up an account, with an account, they'd be able to bookmark this resource within the resource library, allowing them to essentially create a personalized resource library of their own that they can access later, which we will view shortly. Now, let's say if the vendor wanted to share this resource with other farmers market vendors or community nutrition practitioners. With PSEReadi.org, there are a number of options to directly share these resources and information by using social media sites such as Facebook, Twitter, and LinkedIn. Now, while I won't click on them now, when clicking any of these icons, the platform will open up and the URL for the resource and a little bit of information about the resource will be pre-populated into a text field. All you'll need to do then is to customize the message before sharing it with the resource on your platform of choice. Now, we know that social media is a quick and easy way to share useful information and resources with colleagues. But we also know that not all of our colleagues are tech savvy and not all of them use social media. So PSEReadi.org also allows you to share resources via email, and that can be directly to your colleagues through this site. All you would do is enter in the pertinent information, your name, your email address will automatically populate in the box, as well as the name and email of the recipient, and they will receive an email with the link embedded for the resource that you choose to share with them. Now, I'm sure that many of you have used resources or come across resources that you find valuable in your work or that may be beneficial to your colleagues. Now, if you think that you have one that would make a great addition to our library, you can definitely send it to us directly through the system by using this submission form link. And all you would do is similar to sharing the resource with your colleagues. You would fill out your information, the name of the resource, and where we can find the resource. And also, if you can provide a description of it as well, that can help us continuously update our library and make sure that we are pretty up to date with the resources that are kind of best practice that can be used with implementing PSE work. Now, before we continue, I wanted to do kind of a pulse check and ask you, how do SNAP-Ed practitioners in your region currently learn of new resources that may help support their work? And again, you can either respond via the chat box with us or by raising your hand and we can unmute you. Okay, so as Darcy has mentioned, I'm sorry. Oh, okay, awesome, thank you, Nicole. So I see SNAP-Ed email, so I'm thinking that might be on a listserv as well as web searches. Eric, thank you for including the SNAP-Ed connection and the SNAP-Ed toolkit. Great. I was going to mention that Darcy has already talked about using the SNAP-Ed toolkit, and I'm going to, I see that we have, Yolanda had raised her hand, but she included, you know, saying here that they have a curricula specialist as well, with being able to know of the resources that are keeping everyone up to date and being able to ultimately support their work. Awesome. Thank you all for your responses. So now we're going to move into actually exploring the policy, systems, and environmental readiness assessment and decision instrument, which we will affectionately call from now on the PSE Ready, because that is certainly a mouthful. So again, this online tool will help you figure out the level of readiness and capacity to carry out community nutrition PSEs in your area. And by taking the PSE Ready, it allows you to get a tailored report of 3 recommendations for immediate next steps to take in the PSE planning process. So today we'll walk through an individual assessment for farmers markets. And to do this, we would click on the My Account tab in the toolbar on the landing page. Okay. So this takes you to your main account dashboard, and here you'll see 3 sub-tabs below. So first we see My Assessments, which we're going to come back to in 1 second. But if you remember with our review of the resource library, we bookmarked a resource that we found to be useful, and we wanted to use it to begin to build our own library of resources. So here, right here, is the Farmers Market Cookbook, which we favorited in a sense earlier. But then we also have another resource that was favorited from another time that we did a webinar about the PSE Ready. So this is going to be a continuing list of the resources that we favorite, and again, it creates our personal library. Now, when you do create an account for PSEReadi.org, let's say if you needed to change some information, you would be able to do so using the My Profile tab. And it's, again, very easy to create an account. Just as I encourage you all to look at the videos, I encourage you all to create an account and kind of go through the assessment and the entire website to get more of a feel for what it is that these key features are and how it may be able to help support the work of yourself or your colleagues. So I'm going to go back to my assessments, and here we see 4 tabs representing the 4 PSE areas that you can take a PSE assessment in. So we're going to go ahead and start with our farmers market assessment. Now, regardless of what PSE area you decide to take an assessment in, this is an example of what the profile page for each assessment will look like. Now, the purpose of each PSE Ready is to assess only one specific county, which you can further define the target area or community within the county that you want to do your work in. So Darcy has mentioned that Case is located in Cuyahoga County. So that's the county that we're going to select for today. Now, while I'm going to keep it on entire county, users have the ability to focus on a particular area within their county based on their census tract, zip code, city or town, or even a school district. So that, again, allows the report to be very tailored to the user and their target area in which they want to do their work. Now, finally, you will need to name each of your assessments. So it's important to kind of pick a name that is going to be something meaningful. So today we're going to name our assessment SnapEd Midwest Webinar. If I can type correctly, we will name it SnapEd Midwest Webinar. And I'm just going to include today's date, just so we can remember when we started the webinar. Okay. And lastly, before you get into actually taking the assessment, you'll need to make a decision as to whether or not you want to take the assessment as an individual or take it as a team. And here we have our decision tree, which I'll open up. And here is just a flow chart that allows you to, decide whether or not you would like to take the assessment, again, as an individual or as a team. And while this is going to be a very brief review of this flow chart, I will show you where you will be able to access it at a later time. Now, in addition to kind of figuring out whether or not you want to take it as an individual or as a team, you may want to think about, who are those potential team members and who are those people that need to be, at the table. And with this particular guide, you can see examples, and this is certainly not an exhaustive list of potential team members that you might want to invite to have for taking a team assessment. Again, similar with the decision tree, I will be able to show you in a second where you can find these resources later on. Okay, so now that we've decided, where we're going to focus our assessment and what it's going to be named, we're going to go ahead and start an assessment. I'm sorry about that. I'll just take the date off because you cannot name an assessment. You cannot duplicate the name of an assessment. So that was actually important for us to see. Okay. So with every assessment, you will see that there will be introductory language and also examples of what PSE projects are. And of course, this is for farmers market, but for the 3 remaining PSE areas, you will see the different examples of PSE projects and kind of what are who is a practitioner, what does service area mean, just some introductory information that can assist the user as they are taking the assessment. So as we scroll down, we can see the organizational and practitioner capacity theme that Darcy has taught us about not too long ago. In addition to that, we learned that within the farmers market PSE area, you have 30 indicators. So that means 30 questions overall for the assessment. Under organizational and practitioner capacity, we can see that we have a series of questions that we can answer according to a Likert scale. So it allows you to be able to answer as truthfully as possible, and remembering that there is no wrong answer in being able to kind of assess your capacity and your readiness to implement these PSEs. So every question is required to be answered as you go through the assessment to be able to create your report. Now, in the interest of time, I am going to scroll down to the bottom of our assessment and show you how you can save it for later. But essentially, you can also submit and finish, which will allow you to see the immediate report generated afterwards. So again, let's say if there was a question that you just didn't know the answer to at the present moment when you're taking the assessment, you can always save it and start it again at a later time. And I will show you where you would be able to find that assessment. But let's say that you were able to answer all of your questions and you feel confident in your responses that you provided for the assessment, you would hit save and finish, and a report would immediately generate for you. So we're going to go ahead and save. Okay, and we're actually going to go back to my account, which will take us back to that dashboard showing us what are the 4 PSE areas where we can take an assessment. But we would like to scroll down just a bit and see what are all the different assessments that we have either started or completed thus far. So if we look at the top line, we can see the webinar or the PSE Ready entitled SnapEd Midwest webinar that we just started. The reason why I had to change the title of it is because I finished an assessment earlier today with the same title, but it includes the date. So we can see the name of our assessment, the date that it was finished, and we have a couple of other options. We can decide to retake the assessment, or we can share it just as we would with our resources. So sharing it with our colleagues or other team members who might want to see the report and be able to use it for their work as well. So now I'm going to get us into the actual report and review what it is that you would see then. Okay. So before we go down into the actual recommendations that were generated from our assessment responses, you still have the option of sharing your report with others via email, or you can decide to print it out for yourself. Information that will be auto-populated in the report will always be the title of the assessment that you selected, the date that it was completed, and who was the individual who completed the assessment. So this is important information as you decide, who you want to share your report with. Now, there are 2 parts to the report. And we're just going to select recommendation number 1, which is to begin making your budget support farmers market PSE projects. Now with this, you'll see that there is some introductory language that is really helping the user figure out how to actually implement this, this recommendation. So you do have some resources, which you can see are the related resources below that are mentioned in the content of the recommendation, but also resources that you can simply open on your own and again, open in a new tab so you do not lose your place within your actual report. Now, in addition to receiving the 3 recommendations for those immediate next steps, you'll also receive profile information for the county of your choice that you selected when you initially started the assessment. So we're just going to click on socioeconomic profile. And for users in Ohio, this is what they would see. You can see that this information, it can be used to assist and supplement with grant writing and work plan development based on an area's readiness and capacity for change. And it can just also be used to highlight what strengths and challenges that you would like to overcome or identify, really, to be, again, considered with organization stakeholders and funders. And with each of our reports, you have the opportunity to take a look at the different resources that we use to be able to provide you all with this data on the county profile. Okay. I'm going to scroll us back up to the top of our page because I know that there are a number of questions that are coming through our chat box that Karen is taking care of right now. But let's say you have questions about how to navigate the website after today's webinar. Well, of course, again, the webinar will be recorded, so you will be able to go back through the website step by step. But you can also find out more about how to go through the process of taking a PSE Ready assessment through our FAQs. A lot of the information Darcy has already gone over with kind of the background of the PSE Ready, why it was created, who it was created for, and how it can be used. But you can also take a look at how to create an account and using the PSE Ready tool. And I also want to make sure that I mention that you can see the decision tree here with taking the assessment, and you'll also be able to scroll down to see the potential partner guide to, again, help you identify who are the key people that need to be at the table. So that was a very brief review of the website, and I'm going to begin to transition us back to the slides to just briefly go over again what are the key features of the website. So again, we have PSEs in action and PSE resources, which are to help us really generate new ideas or kind of continue to guide us in the ideas that we already have about these interventions, these strategies, or these programs that we want to implement. The PSE Ready assessment is, again, to help users determine what is the starting point for their PSE programs, or how do they need to revamp or reinvent how they want to look at a challenge that they have in their particular target area, and then be able to utilize the recommendations from that assessment that's provided in their PSE Ready reports to guide decisions on PSE plans and help put those plans into action. And it's collectively that these features will help you or your staff assess readiness and capacity for change, plan programs and interventions and strategies, and actively implement them into their community. As Darcy has mentioned, we are in the dissemination phase for the PSE Ready. It initially launched in January of this year, and again, we've continuously been working to introduce people to the tool and how to use the tool. Over 140 practitioners have participated in training opportunities that actually started in November of last year that went into March of this year. And that has included a 4-part webinar series where we have gone over each of the PSE Ready focal areas in detail, but we've also been able to do hands-on training with practitioners throughout the state of Ohio, really be able to learn how to use the tool and ultimately feel comfortable being able to implement PSEs. Now, while a majority of our practitioners reported that they have had previous experience in farm to school and healthy food retail work, we were able to see that the likelihood of use was highest among those who had interest in farmers markets. So this is definitely an applicable PSE area that many of you and many of your colleagues are interested in. But of course, there are some delays that can present themselves as barriers to being able to work on PSEs. Of course, number one is funding. But in addition to that, we have found that whether the practitioner is how their role is being played within their community, and also being able to find collaborative partnerships are also delays that might present themselves when wanting to be able to implement PSEs. But overall, with the training and hopefully as we begin to introduce the tool more outside of Ohio and within the Midwest region, we can add you or your staff to the number of people who have felt that their confidence has increased by going through these trainings and having the hands-on experiences in using the PSE Ready tool. From the trainings that we've had thus far, there's nearly a 3-time increase in the overall training and being able to actually use the tool. And every time that we have a training, we ask practitioners to share one word or a couple of words after they've gone through the training. So usually they may start off feeling apprehensive or anxious or kind of lost. But once we're done with our training, people respond and report that they feel better equipped, more informed, and inspired. So this feedback is positive, and it ultimately helps us to continuously shape the future of the project, which Darcy is actually going to review next for you.
Okay. So we are just going to conclude our formal presentation with a brief overview of where we're headed in the future. One of the things that I mentioned earlier, we are planning to add in a new PSE topic area. Most likely it's going to be focused on implementing PSEs within the school setting beyond farm to school. But we also know there's a lot of interest in our state in food pantry based PSE initiatives. A second thing as we're moving forward, and I think of course related to our presentation today, is we are interested in disseminating the tool beyond Ohio. So for this, what you've seen so far today, and even when Jennifer showed you the county reports, we are working with Ohio SNAP Ed, and so our target has been Ohio. But because we use national level data to create those reports, And a lot of the resources, as Jennifer showed you the example from Maryland with the WIC Farmers Market Cookbook, are not, are from all over the country. The platform provides a lot of efficiency to scale to other states. And part of our process for doing that, we have a number of conferences we've been engaging in. If you're going to the Society for Nutrition Education and Behavior in July, we'll have a poster there. Jennifer and one of our former trainees are heading to Washington, D.C. to do a training for another group focused on early childcare tomorrow, actually. In addition, we are continuing training through our SNAP-Ed partnership here in Ohio, through both in-person and online trainings. That's something I think, as you heard, that targeted training, not just in the tool, which is important, but also in helping people learn more about the PSE topics and feel comfortable in sharing those success stories. In addition, I'm doing more coaching and mentoring as people are beginning to navigate the PSE process and moving from one kind of round of recommendations to the next. We would encourage people to retake a PSE Ready about once every 6 months, or any point in time when they feel like there's been a major change that might affect readiness and capacity. We're also really interested in starting to pool the data as more and more people are taking the readiness assessments, looking at what's variability in readiness across counties. So is there a relationship between readiness and, say, county level poverty rate, or readiness and obesity rate of a county, and also by the PSE topic areas, or even within the PSE themes, are there areas that we then can use to tailor TA based on those readiness barriers. So for example, if we consistently see one of the big challenges is initiating a conversation with corner store owners, that might be something we would be cycling back and working with Anna Claudia and Pat around statewide support. How do we help address that at a broader level? And so I think with that, we really appreciate the opportunity to be able to talk with you and be in the presentation today. And it looks like we've got a number of questions coming from the group. And then we also have some questions here as well. So maybe we can start off with any questions that are coming from the webinar, and then we can move into the questions here. So Karen, is there anything that we haven't addressed yet that we want to come to?
Yes, so we do have a question about resources and if they are free to download and print. So like we mentioned before, all of our resources are resources that are on the internet, and most of them are free, depending on the agency that is hosting them. We do host, or rather we do have a variety of different resources. So some of them may be worksheets that you can actually download and print, but others might be webinars. Some might be actual websites that also include other resources there. And so it's all really dependent on the type of resource that you are accessing. But when you do go to the resource library and you do access a resource, there is a brief description, and in the description it also includes how to access that resource. So it might say, well, this is a listserv, and so in order to join, you might have to email this person that's heading the listserv in order to be added to the list, or it may tell you that it's a webinar, but you might have to, create a username and password in order to access the webinar. And so we make sure to give that information so we can help our users decide whether they want to access that resource, and if they do, how exactly to go about it. So most of the resources are free, and those that are available on our website, you will be able to access them in different ways.
Yeah, and I think, along that, we purposefully made the resource library something you don't need an account to access. The only thing is, if you want to favorite a resource and create your personal library, you would need to have an account for that. Any other questions? Or we have some questions here as well. around, what maybe there are other tools that you're using in your states to tailor PSE strategies to community readiness and capacity. Do you have ideas about how this could be used in your context? Other supports that might be needed to support PSE implementation in diverse communities in which SNAP-Ed practitioners are working. And ultimately, and I think this is something, we're really looking at here, how do we make the PSE Ready tool become part of a sticky practice within SNAP-Ed? Because as long as it's sort of like an extra thing, it's going to be hard to encourage engagement. So, we'd like to open it up for folks to chime in and share some of your insights and experiences and other questions.
And Pat and Anna Claudia, please feel free to join in as well.
Yeah.
Yeah, we just added a question that Eric was posing to us.
Yeah. So I think for us, the question is, training opportunities and how states could use the PSE tool for their needs and any additional costs. So as it is right now, anybody can use the PSE website and anybody could create an account. Where people may find a challenge for use in their state are in a couple of places. One of them, of course, is taking that PSE Ready, and you saw you had to select a county, and we currently only have Ohio counties. And so you don't need a county report. That's sort of like an extra thing. That's sort of a perk to taking a PSE Ready. So you could take a PSE Ready assessment and only get the recommendations and not really worry about a county report that's not relevant to you. But of course, most people they see that, and we hear from a lot of the SNAP-Ed practitioners, they like that report. So for example, we gave a training in May at the regional SNAP-Ed meeting, and one of the pieces of feedback from the audience was she looked at her report for her county, and she talked about how when I look at my county demographics, they don't match who I see at the farmer's market. And that's been one of the strategies in the community. And clearly some of the people that she may be working with in terms of SNAP-Ed may not be represented at the farmer's market space. So that feedback between the data and the report and then her own work, I think is really important to know. But there would be a cost, and we would need to work with states around that to extend to include the state reports. And then the other thing is, relevancy of the website to other states. So right now you see those success stories, they're all Ohio stories. I mean, we would think that people in other states may also want to see their own success stories there. So, I mean, there might be some things we would want to add on or link to. Other resources from other states. I mean, there's nothing stopping us right now from adding in any other state's resources to the library. And then the last thing is more at like a quality of the tool and relevance of the tool for the state. We think it would be important to engage with the state to make sure, we look at the assessment, we look at the themes and the indicators, and, the state sort of agrees, yeah, that makes sense to us in our state. If there's an interest in growing tools, those are other opportunities for further collaboration. So for example, like I said, food pantries is not a current area, but it could be one that we could partner with another state and think about developing.
Thanks, Darcy. You wanted to?
Yeah, no, I this is Ana Claudia. I would say that I think that there's I don't want to speak for yourselves, but I think there's a lot of opportunity. The idea is that there needs to be a plan and then add it to your plan because there's going to be some more resources that will be needed to completely adapt it to your state if that's something that you would want. But as it is, I think it's like it's been said, a very useful tool without even using the specific counties and specific to Ohio. The other thing I wanted to say is that as we know, as SNAP-Ed practitioners, we know that individuals, some of them are really quickly to take new things, others not so much. But throughout our state, we have seen a large number of people utilizing the tool and presenting about their PSEs and how the tool has helped them with overcomes a little bit of challenges or feel more secure about what they're doing when they're connecting with others and what to say. So as a director, I am really supportive, and we have worked really hard at making sure that individuals understand and are able to use this tool, not just as an individual, but with other community partners. So that's
Thanks, Anna. Thank you, Ana Claudia. We definitely want to reiterate that during the SNAP-Ed conference that you all had, really with the Ignite sessions, though our project was not leading that, it was definitely a learning process for us to really see what are the successful PSEs that were being implemented around Ohio, but then also kind of seeing the light bulb go off for other practitioners to understand that this tool is used to support their work and not really add to the number of things that we certainly know that they have already going on within their communities. And we're hoping that we can continue to have that excitement, you know, not only within Ohio, but, you know, with our practitioners, even that we have on the phone today. I want to thank Yolanda because she's been very active in our Q&A with just letting us know how well the site looks and also the excitement about the tool as well. Darcy, is it okay if I ask people to share their one word after what our entire review of the kind of inception to implementation of the project? So in the, whether it's the Q&A feature, raising your hand, or in the chat box, if you can just share one or two words of how you feel after today's webinar, that would be really helpful. Okay, thank you, Yolanda. Yolanda answered, awesome. Thank you, Becky. That's actually a new one. I don't think we've heard growth before, so that's really inspiring to see. Dawn is extremely excited. Okay, opportunities. Well, thank you for you all sharing your one words. Please feel free to continue to share and we'll take a look at those. But Pat, your response of opportunities is really great because there are a number of different opportunities and ways to utilize PSEReadi.org, not only to take the assessment, of course, to really understand where you are kind of in your journey of implementing PSEs, but also utilizing the number of resources that are available. So that goes back to the library of so many websites, so many listservs, so many toolkits and guides, and then also the PSEs in action. Again, very short videos that can be viewed, and you again see kind of real world stories of successes and challenges, but also the opportunities to overcome those challenges. So I think that's really important for us to want to share with you all.
Well, we certainly want to acknowledge that, this has been a really wonderful partnership between Case Western and Ohio State SNAP Ed program and Ohio Department of Health Creating Healthy Communities program. And we're excited to continue our work. And, just in conclusion, you've heard us say, email us bcop@case.edu. We are happy to answer any questions. If you have ideas about how this might be relevant for your community, for your state, reach out and we would love to follow up and begin that conversation. So I don't know if Pat or Eric, if you have any concluding remarks before we wrap up for today.
Yeah, can you guys hear me? Hello? Hello? Hello?
Yeah,
Hello?
we can barely hear you, Eric.
Oh, sorry.
That's okay.
Can you guys hear me better now?
Barely.
Okay. Yeah, something going on with my headset and my phone. So, but yeah, it's like
I just want to say thank you to Jennifer and Darcy and all our participants for showing up this afternoon. I think this was a great opportunity to share, and we'll be in communication soon. Thank you, everyone.
Great.